How do you know you have HIV or not? What are the first signs? What are the early symptoms? And how can you stop the infection from progressing? Now, today we will look at all of these and more as we look at how to know you have HIV with and without blood test. The only way you can know for sure if you have HIV or not is to get tested. Although the virus can cause symptoms, these symptoms are not a reliable way to tell if you are infected or not. In other words, you can't rely on the symptoms to tell whether you have HIV or not. In fact, some people won't have any symptoms at all. So even if you have any of the typical signs and symptoms of an infection, you should always get tested if you think you are at risk. Now, but what are these signs and symptoms? It is important to note that HIV infection happens in 3 stages. Without treatment, it will get worse over time and eventually overwhelm your immune system, getting from one stage to the other. Now, the first stage is the acute HIV infection stage. Most people don't know right away when they have been infected with HIV, but a short time later, they may have symptoms. This stage is when your body's immune system puts up a fight, typically within 2 to 4 weeks after you have gotten the virus. And the symptoms are similar to those of flu, and they typically last 1 week or 2 weeks and then completely go away. And these symptoms include things like headaches, fatigue, aching muscles, sore throats, swollen lymph nodes, and a red rash that doesn't itch, usually on the torso, your body, fever. But some people do not have any symptoms at all during this early stage of HIV infection, that is about 2 to 4 weeks after infection. Now, here's a bit of warning. Don't assume you have HIV just because you have any of these symptoms. No, you may have other illnesses like malaria or flu. But if you think you may have been exposed to HIV, get an HIV test, even if you have had a negative test result in the past. Now, the period of time from when you are infected with HIV to when it can be detected by a blood test is often called window period, meaning that there is a time you may have HIV and yet the test will not detect it. During the window period, the HIV test may give a negative result even though you have HIV. And even though it takes a few weeks after you have been infected for the test to detect it, there are types of tests these days that can detect HIV infection sooner. And if positive and you take your HIV medications and have healthy habits, your HIV infection will likely not progress further. Now, the second stage is the chronic HIV infection stage. And after your immune system loses the battle with HIV, the flu-like symptoms will go away. And most people don't have any symptoms that you can see or feel. So you might not even realize you're infected and yet can pass HIV on to others. And this second stage can last up to 10 years or even more. During this time, untreated HIV will be destroying your immune system slowly and gradually. And without any treatment, you will be vulnerable to other infections. And the key here, the goal here is not to let this phase go on for long. Fortunately, if you have started HIV drugs during this phase, it will help rebuild your immune system and prevent spreading the virus. Now, the third and last stage is AIDS. AIDS is the advanced stage of HIV infection, and if you didn't know you were infected with HIV earlier in the first and second stage, you may realize it after you have some of these symptoms like being tired all the time, swollen lymph nodes in your neck and your groin, fever that lasts for more than 10 days, night sweats, unexplained weight loss, purplish or dark spots on your skin that don't go away, shortness of breath, severe long-lasting diarrhea, yeast infection in your mouth, throat, and vagina, bruises or bleeding you can't explain. Now, people with AIDS who don't take medication only survive about 3 years, even less if they get a dangerous infection. But HIV can still be treated even at this stage. If you start on HIV drugs, stay on them. Follow your doctor's advice regarding your condition, and with the right treatment and a healthy lifestyle, you can live a long time. Now, to conclude this short video, people with HIV don't usually have symptoms right away, so they may not know they have it. It can be years before HIV makes you feel sick, and taking an HIV test is the only way to determine with certainty whether the virus is in the body or not. Did you learn anything new today? Don't forget to hit the like button and stay subscribed, and check the description section for a free ebook titled Fire Your Doctor. Take charge of your health and happiness.